Hi guys, welcome back to my YouTube channel. Okay guys, I'm Nurse Sylvia here again, and to my new subscribers, I'm Nurse Sylvia, living and working in the UK with my family. Okay, and guys, on today's video I'll be talking about my best specialties in nursing. Yes, of course I'm a nurse. I'm just gonna talk about the specialties in nursing that are my best. Yeah, there's so many specialties in nursing, but guys, these are my best, and I'll be letting you know why they are my best. If this is what you're interested about, just stick around the video. Let's dive into the video. Okay, so guys, the first one on my list would be, I think I'll just leave my very best to the last. Just stick around, and then if you want to know where I am currently, I'm sure most of you know anyway, so but in case you don't know, I'm just going to mention it. It will be my last specialty that I'm going to mention. Okay, so if this is what you want to hear, just stick around. Okay, so the first one on my list will be the community nurse. That's community nursing, you know, where you have to go house to house to help with patients in their homes, help with their wound dressing, help with their IV medications, you know, look after them, their medication, oral medications as well sometimes. So I think I like it, the flexibility it comes with, because in a day you might just have like 5 patients or 4 or 6 depending, because you have to like drive to their place or take a bus, or you know, usually some hospitals might, you know, pay for your fuel or your transportation and, you know, take you to those houses. Yeah, so I think I like that one. The second one on my list would be the ICU nurses, that's the critical care nurses, yeah, intensive care nurses. Okay, so these usually are one-to-one care. So, you know, one-to-one care. Sometimes you can have I think the highest I've seen is two patients to one nurse. Yeah, so it's just basically a high intensive care unit where you have to deal with patients that require, you know, a high care. Yeah, so I think that's another of my specialty. The next one will be mental health nurses. Yeah, so mental health, you know, they can work in the hospitals, they can work in the community as well. You know, there's so many people out there, you know, that need mental health issues to be solved. So, you know, it's one of my best specialties. Okay, and of course they pay high. They're one of the high paid nurses. Okay, yeah, so that one as well, I think you have, when you meet your clients, it's usually, you know, one-on-one, speak to them, try to get to know them, you know, build a trust with them so that they can trust you to, like, you know, relay their problems to you. Okay, the next one on my list would be the research nurse. Yeah, so the research nurse just supporting clinical trials, help to monitor the progress of the clients that are being treated and ensure that they follow the, you know, study protocols. They do data collection, they do academic reporting, they do a whole lot of monitoring and trying to get results of any particular, you know, case study. Okay, so I think that one is not really on the bedside. This is like, if you don't want a bedside specialty, I think this is, you know, going to be one of my best if I'm gonna go outside like the hospital. Okay, yeah, so yeah, just about, you know, doing some scientific stuff, research and all of that. So that would be one of my best specialties. Yeah, and another one on my list would be the occupational health nurse. Yeah, so most people that have joined the trust in the UK or just newly joined care home or something, they usually have this onboarding program, yes, or process, where you have to do your occupational health check. So the people you meet for the occupational health check are the nurse, are the occupational health nurses, where they take your bloods, they give you some vaccines, they do regular checkups on you, regular vaccines on you. You know, if you have any like needle prick or anything, maybe blood splashed in your eyes or any related health problem from work, relay your problems to them. Okay, yes, and then the next one on my list will be but gradually coming to my very best. That's the one I am, guys. So the next one will be the anesthetic nurse. So usually if you're a nurse and do the anesthetic training or the ODP training for at least 9 months, yeah, you become an anesthetic nurse. But if you go through the ODP training, like the ODP course, it's like 3 years if you're not a nurse. So you know, and you become an ODP. So the ODP and the anesthetic nurse is almost similar. Yeah, they assist the anesthetists who give the anesthesia to the patients going for surgery. Yeah, so guys, let's not get it mixed up. So they are the ones that assist the anesthetic nurse, the ODPs. They assist the anesthetist, that's the doctor who gives the anesthesia to the patient. Okay, they help with equipment for the anesthesia. They you know, they help with the medications that the anesthetist will use, making sure that the machines for the surgery for the anesthetics is, you know, is working perfectly. Okay, yes, so that's that one. So for the last but not the least, guys, it's my own specialty, which is what? Wow, drum rolls. So it will be the theater nurse. So guys, I'm a theater nurse in the UK. So it's my best. It's my best so far. I love it. I love in theaters, you know. So the theater nurses or the scrub nurses are responsible. So in the theater, you have the scrub nurses, you have the circulators. So the scrub nurses, you know, assist the surgeons, you know, with the past instruments, making sure the, you know, the sterile field is kept sterile. You know, the scrub along with the surgeon, you know, making sure it's the right equipment used for, you know, the right case, making sure all instruments, all machines or equipment are sterile before it's been used on the patient. Yeah, then the circulators are those that help to make sure that the noise in the theater is being reduced so that the anesthetist can intubate the patient and also extubate the patient. Yeah, so making sure that there is no so much movement in the theater, no much noise in the theater, making sure that the sterile field also doesn't get contaminated. So that is that. So guys, tell me in the comment section which specialty you are or which one you're going for. Thank you so much for coming to the end of my video, and don't forget to like, share, subscribe and leave a comment. Thank you. Bye bye.